Yeah, please be seated and welcome to the 12th Annual Summit Meeting of the Patient Safety Movement Foundation. Now, it is an annual meeting, but in fact, last year's been a very long year, and we're 18 months into it, but we're alive well and doing well thanks to all the support that we've had throughout that time. I want to show some slides here. We've had some changes, unfortunately. First, to recognize Lenore Alexander, who was one of our strongest advocates when we started out for many, many years. She passed away this last year. Her daughter, Leah, was 11 years old, had chest surgery, and was on an opioid infusion post-operatively. Leonore knew that was dangerous, and the medical staff said, no, we do this all the time, it's fine. She slept in the same room as her daughter in the intensive care unit at the hospital, and woke up at 1 o'clock to find her daughter dead. So she's been really a big supporter of what we can do to make a difference with patient safety. I mean, all she needed was a monitor. And we've been pushing for that, to monitor people on opioid infusions, at least naive people with opioids on opioid infusions, as is the Anesthesia Patient Safety Foundation. And now most hospitals will do that. But why doesn't everybody do it? So that's what we've got to make the change this year. We've got to be sure that basic safety measures are taken on everybody that comes into our hospitals. We also, unfortunately, lost Janica. Janica Mellon Olsen was just a tremendous person. If she was in this room, you'd already know she was here. She had the most infectious laugh, but she was so dedicated to patient safety. She's from Norway, and she suddenly passed away last February. But she got the highest civilian honor by the King of Norway for her work on patient safety. She was president of the World Patient Safety Federation, World Anesthesia Patient Safety Federation. She's just done a tremendous amount of work, and we will miss her sorely. And also Dr. Philip Lum, one of our governance board members, passed away. He was head of anesthesia and critical care at USC, and a very measured speaker, quiet, but when Philip talked, you listened. And he had great advice for us, and he too passed away suddenly after a very short illness, so we will miss them terribly. So with that, we're now on track. Do I have another slide? I think I probably do. Because this is a two-day meeting squeezed into one day, we're not going to have time for questions at the time. So these grids are available. You can either take a photograph now if you've got a chance, or it'll be on our website. But please email questions afterwards, or talk to people in the breaks and to catch up. But just in the interest of time, we're going to just keep moving today to get through on time. Next. And we'd love to thank all our sponsors. It's been really great that we have got this meeting today, so thank you. Particularly the Kiani Foundation, and Joe has been our founder, and Joe and Sarah have supported us through these 12 and a half years, and we thank them very much indeed, Joe. Thank you. So with that, we're going now to go to what we're here about is a patient video. And we're going to just show you a short video of an unfortunate late diagnosis, misdiagnosis that cost the life of a small child. So with that, please show the video.
My wife was pregnant with our second child. We knew it was going to be a boy. Drove my wife to the hospital. I think I got there at about 6 o'clock, which was just in time because Joshua was born at exactly 7:38 on that Monday morning. And when he was born, my reaction was, thank goodness, he was just a perfect, healthy, beautiful little baby boy. It was about 30 minutes later that things started to go wrong. He had a low temperature, he wasn't breathing properly, he was reluctant to feed, But at the time, we were just reassured, he's a little bit premature, all these things are normal. The next day, it was obvious he was a very poorly baby at that point. He was transferred to Manchester by ambulance. The team in Manchester told us, actually the only thing wrong with Joshua is he's had an overwhelming infection and he's suffering from sepsis. We kept thinking, Joshua is here for that basic lack of care that he could have had in the first hour of his life, and he wouldn't be here at all. He was actually flown by helicopter from Manchester to the Freeman Hospital in Newcastle, and that's when we were advised about this treatment called ECMO, basically a heart and lung machine for babies. Unknown at the time, his left lung began to bleed because it was more damaged than anyone realised. And the consultant had a conversation with my wife and I and said, look, if we tried this operation, it'll be futile, and we just worried it will make him suffer more. So on the 5th of November, the consultant said he's going to turn the ECMO machine off. And he went away. 20 minutes later, it came back, and we said, he's gone, hasn't he? And the consultant nodded his head. And Joshua had died. I think the first time, actually, at that point, we'd seen him without all the tubes and all the equipment, and he just looked like the perfect baby boy. We said goodbye to him, and the hardest moment of my life, without a doubt, the hardest moment. What I remember thinking was, if Joshua's care was this bad, if he had so many obvious signs that he was poorly, and he was just left until he collapsed, is it just him? Or could this have happened to other babies? What we know is that there were huge discrepancies between what the midwives had reported and what my wife and I remember happening. I'd actually met a number of other families. These are families that had lost babies. It seemed that the pattern of what happened was very, very familiar, so doctors not being called, investigations that covered up what happened. In early 2013, I met the health secretary at the time, Jeremy Hunt. He agreed to hold an independent investigation, and it found a lethal mix of failures, and the words in the report were that we have no doubt led to the preventable death of mothers and babies. And they found that 16 babies and 3 mothers had died following poor care, and of those, 11 would have almost certainly survived with the right care. And the tragedy, really, for me, is 6 of those baby deaths happened after Joshua died. The whole management of the trust for years and years, denying that there were any problems, using statistics to paint a picture of a very safe maternity unit. They described that as an ongoing cover-up. And this became the headlines in England for over a week. There's no doubt to my mind that those records didn't vanish by accident. Somebody took those medical records and made a decision that it was better to get rid of them than to present the evidence. My reflection very much was, why didn't they learn from this?
And you realise that we've got the culture wrong in healthcare. We just make it too hard for people to admit to ordinary human error, whereas things like the airline industry, the oil industry, the nuclear industry, they have all learned that they need to make it easy for people to admit when they made a mistake so that they can then develop the systems that prevent those mistakes being repeated.
And there's a real danger, I think, of people using high-level data to misrepresent and using data for assurance rather than actually what can we learn from this.
Because if you don't quantify the problem, we won't get action to change it.
And we've got to have that honesty and that candour to address problems. I wish I could turn back the clock. I can't do that. I can't change things for him. But I do think his life hasn't been in vain, and I think there is a legacy for him, and hopefully that legacy is safer maternity care, and I think he's played a small part in helping that happen.
the First Lady, Dr. Jill Biden, Mr. Joe Kiani, Sir Jeremy Hunt, dear colleagues and friends, it seems self-evident that nobody should be harmed while seeking care. And yet, unsafe care affects around 1 in 10 patients globally, leading to more than 3 million deaths globally each year. Patient safety must be a non-negotiable priority in all health systems, at all levels of care, in all communities, at all income levels. Yet, only 25% of countries have a national patient safety action plan, and even less have patient safety in health training curriculums or include patients' voices in hospital governance. Real change happens when leaders, health workers, innovators, and patients unite with shared purpose and determination. The Patient Safety Watch report, supported by the Patient Safety Movement Foundation, the UK government, the Imperial College London, shows how collaboration informs progress. The Kiani International Fellowship Program demonstrates how leadership investment catalyzes lasting transformation. WHO is committed to advancing patient safety and quality of care globally. Together with countries and partners, we're advancing initiatives like the Global Patient Safety Collaborative, working with leaders across countries to drive meaningful, lasting change. Thank you for your commitment to supporting action for patient safety and our shared goal to prevent avoidable harm. Because if it isn't safe, it isn't care. I thank you.